Welcome to video number 2, What to Expect During Your Treatment. My name is Melina and I'm a nurse on the second floor of the Cancer Center Adult Clinic in the UC Davis Comprehensive Cancer Center. What is chemotherapy and immunotherapy? Chemotherapy is drugs that we use to treat your cancer by attacking rapidly dividing cancer cells. Immunotherapy is a treatment that uses your immune system to recognize and attack those cancer cells. Targeted therapy is a therapy that is able to specifically act on molecules on the cancer cells to reduce their growth and stop the spread of those cancer cells. There are many kinds of therapy and ways to give it. Your treatment plan may include a single medication, a combination, and they can all be given on different schedules. Examples of ways that you may be getting your treatment are through short infusions in our infusion center, long continuous infusions in the hospital, possibly for an overnight stay or multiple stay in the hospital. We can also give it as a subcutaneous, meaning an injection into the fatty tissue, or intramuscular, which is an injection into the muscle. Why do people with the same cancer get different treatments? So with your oncologist, you're going to be looking at the type and stage of cancer that you have. They will also be partnering with you and looking at the current standard of care treatment that's offered for your cancer type. What that means is essentially what's the best practice or what's the most common accepted treatment for your cancer type. Your doctor is also looking at your age and your overall health status. For example, do you have any other comorbidities or diseases that may affect your cancer treatment? What's your organ function, like taking a look at your heart and your kidneys? They also will look at your past exposure to previous cancer treatments. For example, have you received treatment in the past for a previous cancer? They also will partner with you in looking at the goals of your therapy. Why are we treating you? Some goals include neoadjuvant therapy, meaning giving you treatment prior to surgery. Adjuvant therapy, giving you a treatment after the main course of treatment. For example, chemotherapy after surgery. Are we giving you treatment to cause a remission? Causing a remission is when we give you treatment with the goal of having all the signs or symptoms of cancer disappear. We can also treat you for a goal of palliation. Palliative goal means we're treating you with the goal of reducing your cancer-related symptoms such as pain. What is the goal of chemotherapy and immunotherapy? Together with your oncologist, you may develop a goal. So you want to know what that goal is in partnership with your doctor before starting your treatment. Some of the goals include trying to cure your cancer. Curing your cancer means we're eliminating the cancer cells, and they are no longer detectable in the body, with the expectation it will not return. We can give you treatment to control your cancer. This stops the cancer cells from growing or spreading to other parts of the body. This is similar to a remission. A remission is where we give you treatment to have the symptoms of your cancer disappear. This remission can be partial or complete, with the chance that your cancer may return at a later time. We can give you treatment to ease your cancer symptoms. For example, we may be giving you treatment to reduce a tumor that may be causing pain or improve your quality of life. What is the goal of clinical trials? Clinical trials answer a specific research question. They answer questions such as whether a promising investigational drug will work on your cancer, or they can take a look at whether a newly improved drug or treatment or a new combination works better than the current standard of care treatment. The goal of clinical trials is to determine if these treatments are safe and effective. Is a clinical trial an option for me? Talk to your doctor if a clinical trial is an available or good option. Patients are educated, screened, and consented prior to starting on a clinical trial treatment. As a part of your clinical trial team, you'll have your physician or oncologist, a clinical trials coordinator, and your nurse to support you going through treatment. If you do decide to go on a clinical trial, you can stop participation at any time if you choose to do so. How are chemo and other cancer treatments given? Most are administered in one of these ways. We can give you your treatment orally or by mouth, meaning a pill or a capsule form, intravenous, which is an IV route, or by injection. Other less common routes that you may need as a part of your treatment include topical, meaning a lotion or medication applied on the skin. Intrathecal. Intrathecal is an injection that goes into your lower back in the spine to instill anti-cancer medication into the cerebrospinal fluid to either treat disease present there or prevent disease coming back there. Intraperitoneal. That's an injection of anti-cancer drugs into the abdominal cavity through a small catheter. Another route includes intravesical. This is where we can insert anti-cancer medications through a catheter into your bladder to treat disease present there. What are the different types of intravenous lines? The most common form is a peripheral IV. This is a small catheter that the infusion nurse will place in the infusion center prior to your treatment start. This peripheral IV can then be removed after your infusion is complete before you leave the infusion center. Another option for your treatment is a tunneled catheter such as a portacath. A portacath is a small disc that's inserted during a small surgery in the skin in your chest. During your infusion, the nurses will access that portacath and remove it when your infusion is complete. The portacath is a safe option for the infusion of your cancer treatment. Another option is the PICC. A PICC is a peripherally inserted central catheter. That line is placed by a trained nurse, and its located or insertion site is just above the inner part of your elbow here. There is a dressing in place and external lines. The PICC line is a safe option for the administration of your cancer treatment. It does require some maintenance, meaning weekly infusion center visits for a dressing change to keep the site clean, dry, and the dressing intact. Are my infusion treatments painful? Your infusion treatments should not be painful. Tell your nurse in the infusion center immediately if you feel burning, swelling, itching, or pain at the infusion site. When you get home, if you have pain, swelling, or redness at the site of infusion, please call us at the Adult Cancer Center Clinic. If it is after hours, please call the on-call doctor and ask to speak to the oncologist on call at the phone number listed on the slide. For comfort at the infusion site, you may apply a warm compress. However, do not apply it if it's red or swollen. And now I'll hand it off to my colleague Lauren.
Hi, my name is Lauren. I'm a clinic nurse in the Cancer Center Adult Clinic. I'm going to be talking to you about what your treatment will look like and what you can expect. So first, what does your treatment cycle look like? So everyone is going to have a different cycle, and it's going to depend on your specific cancer and the treatment plan that your team has created for you. Most commonly, we'll see a 14-day, 21-day, and 28-day cycle. The expectation is that you're going to see your provider prior to starting each new cycle, and the number of cycles will be determined by your oncologist. We do expect you to have blood work done 2 to 3 days prior to each treatment, and you should be getting a copy of your treatment plan from your nurse case manager. If you have not received one, I do recommend that you talk to your nurse case manager so that you can obtain it. It does thoroughly outline what to expect throughout your cycle. Why is it important to stay on schedule? In order for you to get the maximum benefit from the treatment that we are giving you, it is important to stay on your treatment cycle, especially because many of these chemotherapies are timed to hit the cell cycle at a certain point, and if we delay treatment multiple times, then you're not getting the maximum benefit from the treatment. What would cause treatment delays? So one of the things that can cause a delay would be that if you don't have your blood work on time. You'll hear me say multiple times, you need to have your lab work done 2 to 3 days prior to you obtaining your treatment, and that helps us determine whether or not it's safe for us to give you treatment, or if there's anything that we need to do to correct any of those values that may be off. Another reason would be that if your electrolytes or if your red blood cells or your white blood cells do not meet your treatment parameters, that would also be a reason for us to delay treatment, which again is why it's important to check your labs. If you do not keep that appointment with your nurse practitioner or your oncologist, then potentially we don't have that check-in with you to determine whether or not it's safe for you to proceed on to treatment, and we may delay your treatment. Also, we want to check in with you to make sure whether or not you're having any severe side effects that would cause us to perhaps reduce the amount of chemotherapy that we're giving you, or to delay your treatment for maybe a week or so to allow you to recover, and then maybe also your blood counts to recover. If your treatment was to be canceled, you should follow up with the infusion center to make sure that you've been rescheduled for the appropriate time. Your team will send an email to the infusion schedulers to make sure that you are getting scheduled for the appropriate time and let them know that a delay is happening. Typically, if we are going to delay your treatment, it's going to last for about a week, sometimes longer, but on average, we're going to delay you by a week. So everything in your cycle will be set out by a week. And then you will proceed to treatment as normal, making sure that you do get your labs again within that 2 to 3 days prior to treatment, so we make sure that you are meeting your parameters again before we give you treatment. So what happens during a treatment cycle? This is an example of a 14-day cycle, and remember, some of you are going to be having a 14-day, a 21-day, or a 28-day cycle. So this is just an example to give you an idea of what to expect during the cycle. So you're going to have treatment potentially on day 1, and remember, everybody's cycle is different. So you may be getting treatment on day 1, day 8, day 15, day 1, day 2, day 3. It just really depends on what your treatment plan is. But for this example, you're going to be getting treatment on day 1, and then we know that the highest concentration of chemotherapy in your system is going to be within that 48 to 72 hours after you get treatment. So that means that the 48 to 72 hours after treatment, we can anticipate your higher risk for having side effects related to your treatment. This example shows nausea. And so during that time, we may potentially be giving you some medications to help manage and or prevent you from having some of those side effects, which again will be specific to your treatment and in your treatment plan. Then around mid-cycle, so right about in the middle, we're going to hit your nadir. And we'll talk more about your nadir in a little bit, but the nadir basically means where do we see your white blood cell count drop to its lowest before it begins to recover. And then closer to the end of the cycle, again, 2 to 3 days before your next cycle, you're going to have your labs done, and you're also going to have a visit either with your oncologist or with one of the nurse practitioners as a check-in, a pre-symptom check to make sure it's okay to proceed on to treatment. This is an example of a 21-day cycle. Again, it's important to remember that everybody's treatment is going to be different. The nadirs are different for each chemotherapy, and if you are on a treatment regimen that has more than one chemotherapy, then we're looking more at a combination of the different nadirs for the different chemotherapies that you're getting. But for the example provided here, I like to explain to people the nadir as your white blood cell count or your immune status starting out at the top of a hill. We're going to see after you get treatment, you're okay for a couple days, and then you take a dip down, and then you drop down to the bottom of the hill. Now, when you're coming down the bottom of the hill, you've hit the bottom of the hill, and then you start to come back up, that is the time where you are most immunocompromised and most at risk for getting an infection. So during that time period, we want you to be very careful. So again, you come down to the bottom of the hill, you hit your bottom, and then your white blood cell count starts to recover, and then you get back up to the top of the hill. It's important to remember that chemotherapy side effects overall on your body and on your immune system are cumulative. So over time, depending on how many cycles you have, as we get further into the cycles, we do anticipate that potentially it may be harder and harder for you to come back up that hill and get all the way back up to the top. You may only be able to get up to this level, and then this level, and then this level, depending on what treatment we're giving you and how many cycles you're getting. But again, it's important to think about your immune status as you are least immunocompromised the few days right after you get your treatment and the few days right before you get your next treatment. So right at that little window, right after you get treatment and right before your next one. So this is just a cycle example of what I was just talking about. So we start with green, you get chemo, and then you're moving on to getting closer towards your nadir. And then you hit that bottom of the hill in red, which is your highest risk again for infection because your white blood cell count is going to be at its lowest and therefore you're most immunocompromised. And then we start up the hill to your recovery period And then we give you chemo all over again and we do it all over again. So what does your treatment schedule look like? So this is an example of a calendar that is not going to be specific to everyone. It is very helpful to get a calendar from your nurse case manager so they can give you an idea of what your treatment cycle is going to look like. So this person, for example, is on a 21-day cycle, and they're getting chemotherapy 2 times within that cycle on day 1 and day 8. So if we look at the calendar, the cycle starts, cycle 1, day 1 of the cycle starts on Tuesday the 5th. And again, labs are due prior to that treatment day. You get treatment, and then we continue on until the following week, where day 8 is due, which is going to be Tuesday the 12th. And again, remember, you have to have labs done before that treatment. This is just an example. Some people will get chemo multiple times within their cycle, but they may only have to do labs once, or you might have to do labs every single time. So it's important, again, to get your treatment plan and to get a calendar from your case manager. Then we'll continue on throughout the cycle until we hit the end of the 3rd week. And you can see on day 22, day 18, the example is that you then have your pre-treatment visit with your provider, again, either the doctor or the nurse practitioner, prior to you having treatment the following week. And then on Tuesday the 26th, you can see it says cycle 2, day 1, so that means we're starting all over again with a brand new cycle. What do I need to know about my labs and my blood counts? So again, lab work is super important because it's one of the ways that we can determine whether or not it's safe to give you treatment. Some people have very minimal side effects, but their labs let us know that potentially there's something else going on internally that we cannot see. So again, it's very important to get your labs done 2 to 3 days prior to treatment, especially if you are somebody who is getting labs done outside of a UC Davis lab. It can take us several days to get those labs. So again, the request is that you have them done 2 to 3 days ahead of time so we have time to review your labs and make sure that it's safe for you to have treatment. Also, for those of you who may be living further away from UC Davis and coming for treatment, it gives us time to get in touch with you and confirm that you're not going to have treatment, that maybe we're delaying by a week, and so it gives you and us more time to plan. So in terms of looking at what types of labs we're usually ordering for you, the 2 most common that pretty much everybody's going to have drawn are your CBC and your CMP. Your CBC is your complete blood count, where we're looking at your white blood cells, your red blood cells, and your platelets. And the CMP is the comprehensive metabolic panel. We're going to be looking at your electrolytes, your liver function, your kidney function. It lets us know how your organs are functioning. You may have additional labs other than just the CBC and the CMP, but pretty much everybody's going to have a CBC and a CMP drawn. So let's talk about what is your WBC. So your WBC is one of your blood cells. It's your white blood cells. Your white blood cells help you to fight off infection, and we do know that many of these chemotherapies are going to cause a decrease in the number of white blood cells that you have. You may hear us say neutropenia or that you're neutropenic. So basically that means that your white blood cell count is low, which when you get your treatment plan, we should be including in there your treatment parameters, which almost always is going to include an ANC, which is your absolute neutrophil count. Your neutrophils are the white blood cells that you have the most of in your body. Think of them as your infantry in your immune system. They are constantly being replenished. They're the most plentiful, and they actually don't live for very long. So they give us the most accurate picture as to what is the current status of your immune system at that given time when we take your blood. And remember, your ANC, sometimes you can see a recovery within just a couple of days if you're at the end of your cycle. So sometimes your provider may ask you to repeat your labs the day of or 1 day prior to treatment if we found that your ANC almost met parameters but just wasn't quite there yet. Because when you are at the end of your treatment cycle about to start a new one and you've come out of your nadir, then we can anticipate that your body should be recovering a little bit faster than it did initially closer to that nadir. The other thing to keep in mind is sometimes we will order medication for you to help stimulate white blood cell production. Not everybody gets this and not everybody needs it. It's not a short-term fix. It's something that will help you to build and release more white blood cells over time. So it's more of a protective benefit, but again, not everybody needs this because of course there are side effects to these medications. And so potentially your treatment plan will outline whether or not we've already pre-planned to give this to you, and sometimes, depending on how your body responds to treatment, we may prescribe it for you later on in treatment. What are RBCs, your red blood cells? So red blood cells have hemoglobin on them, which if you imagine are little trucks that move around your body and help to deliver oxygen to all of your various organs and your muscles. Obviously, your muscles and your organs cannot function without oxygen, so looking at your RBCs and specifically your hemoglobin levels is really important. Some of these treatments will cause your RBC levels to be decreased, so of course we're going to be looking at that and your hemoglobin when you're getting your treatment and your labs. Some of the more common symptoms of low RBCs, which many of you may know as anemia, is feeling really tired or fatigued. Unfortunately, fatigue and feeling tired is a common side effect of many of these therapies, so it's not just unique to those that potentially can reduce your RBCs. Maybe you're feeling short of breath with activity, maybe you're feeling dizzy or lightheaded, and some people can be very anemic and have no symptoms at all. It really varies from person to person. However, if you are having extreme fatigue, meaning you're having great difficulty getting out of bed, you're feeling short of breath when you're walking around, and when you sit down to rest, that shortness of breath doesn't go away, or same thing with dizziness, you're feeling dizzy all the time, you sit down, it's not going away, then you need to call and let us know, and we need to check your counts and make sure you're not anemic and at the point where potentially you might need a blood transfusion. So let's talk about platelets. What do you need to know about your platelets? Platelets are cells within the body that help to form clots and therefore prevent bleeding. We also know that some of these treatments can reduce the number of platelets that we have in our body and also the way that the platelets and at the rate that the platelets are produced. Some of the symptoms of having low platelets are you might have bruising. So unusual bruising that happens very easily. You might just bump your arm on a table and all of a sudden you have this very large bruise. Sometimes you might also see a little pinpoint red or purple dotted rash called petechiae. You might see those on your arms, you might see them on your trunk, you might see them so on your belly, on your back, you can see them on your legs. The difference between the petechiae rash that's caused by not having enough platelets and a skin rash that's caused by chemotherapy, well, both are caused by chemotherapy, is if you closed your eyes and you felt over the rash and you didn't feel any bumps, then that is petechiae, because remember those the bruising is happening underneath the skin, so you won't be able to feel it. So it's a good way to tell the difference between petechiae and a skin rash caused by chemo. Another thing to be vigilant about is nosebleeds. If you're having frequent nosebleeds and bleeds that are really hard to stop, then you definitely need to let us know. And if you're having bleeding gums, either when brushing your teeth or unprovoked, you're just having bleeding gums. If you're having bleeding coming from your vagina or from your bottom, or if you're seeing blood in your urine or in your stool, then you definitely need to give us a call. Likely what we're going to do is have you come in and check your lab so we can see whether or not your platelets are extremely low. And we don't give platelet transfusions out just because your platelets are lower than normal. We typically watch them to see how low they'll go prior to deciding to give you a platelet transfusion. The important thing to remember about platelet transfusions is platelets don't last in the body very long, so we're very careful about who we give them to, and we only give them if they're truly needed. Why does my treatment cause side effects? So we know that chemotherapy is essentially being given to you and it's going throughout your entire body, and it does not discriminate against cancerous cells versus healthy cells, so it's attacking all quickly, rapidly dividing cells. So we know that the more common side effects that we'll see from those rapidly dividing cells are hair loss. It's important to keep in mind not everybody loses their hair with chemotherapy. Some people have complete loss, some people have thinning, some don't have any. It just really depends on what treatment you're getting, and you can discuss that with your nurse case manager and they can confirm with you whether or not that would be the case. It's also important to remember your oral, your mucosal lining, your intestines. So think about starting from your mouth, your tongue inside your mouth, going down your esophagus, into your stomach, and then all the way through your intestines and then out your rectum. Basically, that's your entire GI tract, and that entire tract can be affected by your chemotherapy. So we can see mouth sores, we can have reflux or upset stomach, you might be having diarrhea. So those are things that we can all treat. We just need you to communicate with us and let us know if you're having those side effects. And oftentimes we will pre-treat some of those symptoms to prevent them. So some of you may have medications that you're going to take after you get your chemotherapy, and again, that'll be in your treatment plan. We also know that your white blood cells, your red blood cells, and your platelets can be affected, as we just talked about. And so that concludes my part, and I'm going to hand this off then to Colleen Herron for part 4.